All right, moving on to the counselor-client relationship. Those are some of the key ideas. How do we apply these ideas in the counseling relationship? An REBT counseling relationship has been well defined as having some specific characteristics. So Alice talked about the fact that REBT counselors would be active and directive with most clients. They would be risk takers. They would act on their hunches. They would say what they were thinking. They would be intelligent and knowledgeable, vigorous in detecting and disputing irrational ideas, and as persistent and empathic. The process of REBT is one of educating the client in the skill of identifying and effectively disputing irrational beliefs. It would be characterized as an educational process where we're teaching people about these ideas, teaching people the ABC model, we're teaching people to identify their irrational beliefs, and we're teaching them to effectively dispute these irrational beliefs. We do this in the context of an accepting relationship, open and direct communication. A warm relationship, according to Ellis, is desirable, but not necessary and certainly not sufficient. So, direct response to Carl Rogers' idea there. Ellis said a warm relationship is nice, it's desirable, it makes things go better, but it is not necessary. REBT can be conducted in the absence of such a relationship, and certainly not sufficient. Counselors will often use the time-saving and efficient tools of questionnaires, self-help forms, and homework would be frequently used in the REBT counseling process. In the REBT counseling process, there's this idea that in order for counseling to be effective, the counselor must convey 3 insights, and the client must come to understand 3 things. First insight is that we largely choose to disturb ourselves about the events in our lives. The unpleasant events, we choose to disturb ourselves, even though you may be influenced to do so by external factors. It is on us. We are choosing to make ourselves upset. We feel the way we think. Insight 2, regardless of how or when you acquired your present self-disturbing and self-defeating beliefs, you are choosing to maintain them in the present, and that is why you are disturbed now. Alright, so the idea here is, again, we're not going to spend time talking about where this came from in your childhood, because regardless of where it came from, it is in the present right now that you are maintaining these ideas, that you are continuing to tell yourself these things, that you are disturbing yourself by failing to change the way you're thinking. So your past history and your present life conditions affect you, but they don't disturb you. You are disturbing yourself by maintaining them. And insight number 3, there's no magical way for you to change your personality and your tendencies to upset yourself. There's no insight that is going to occur and you will be magically fixed. The idea here is that change takes hard work and practice. This is a process that takes continued work and attention and practice. So once the client understands these 3 insights, then REBT will be more effective. Some of the ways that we work with clients to develop insight about the way that they're disturbing themselves, about the beliefs and cognitions, the feelings and the behavior that is causing them problems, are the following techniques. So we're going to talk about cognitive techniques, behavioral techniques, and emotive or emotional techniques. We work with people on all 3 modes. So some of the cognitive techniques include, first of all, logical disputes. where the aim is to weaken the client's affinity for an irrational belief by pointing out the faulty logic of it. So trying to separate people from their irrational beliefs, trying to help them to come up with more rational beliefs by helping them to dispute the logic of it, helping them to look at the belief and see if it makes sense. So you might ask a person, for example, does it follow that if you don't have any friends, does it follow that you've been telling me about these various relationships that you're in? Does it seem consistent to you that you're saying this, but you're also saying that? Does it follow logically? So we're looking at the logic of the beliefs and having the person work it through and understand that there is an inconsistency and they need to change the way that they are defining things. Empirical disputes. In this strategy, the counselor invites the client to provide evidence for the belief, that is, the irrational belief, and tries to show that the irrational belief is inconsistent with reality. So you're telling me that you are a worthless person. Where's the evidence? What is the proof that you have? So prove it. Cognitive techniques continued. The functional dispute. In this strategy, we try to show the client that it is not practical or pragmatic or helpful to continue to hold the irrational beliefs, and they are actually paying for maintaining these irrational beliefs. They're paying emotional and behavioral consequences for continuing to do so. So showing them that it's not only is it not getting them what they want, it's not helping them to reach their goals, but it's actually preventing them from reaching their goals. Common leads here would include things like, does your holding this belief get you what you want in life? Is this getting what you want? Can you tell me what feelings you're experiencing as a result of that belief? So you're identifying the belief, you're getting the client to become aware of the belief, and then you're looking at the consequences of the belief. Rational alternative disputes. In attempting and disputing and attempting to restructure the maladaptive beliefs, the counselor must offer an alternative. What we're saying here is that when you take something away, even if it hasn't been working, it is something that the person has been using, and when we're taking away a behavior, we need to replace it. So when we are taking away a belief that the person has been using, we need to help them to replace it. If they're taking away a cognitive response, a belief that they have, a phrase that they've been telling themselves, we're encouraging them to stop using that, but we want to give them something else that is going to work. So a replacement belief which has fewer emotional and behavioral consequences. So for example, it would be very disappointing if I didn't get this job, but it would not be terrible, awful, or the end of the world. If a person is saying that if these people at my new job or if these people at school don't like me, it's going to confirm that I am a useless, worthless person, take that belief and you modify it. If they don't like me, that is unfortunate, but it doesn't mean that I am a bad or worthless person, and that sort of thing. You can think of other examples. Semantic precision is encouraging people to be aware of their language and to be aware that the language that we use, the things that we tell ourselves, we need to be careful with that, and we need to sometimes change it. Sometimes the language we use perpetuates our irrational beliefs. So instead of saying I cannot do that, you might change that and change the meaning of that by saying I have not done that yet, for example. So reframing. Reframing is teaching the client to redefine the situation in a more positive light. Instead of defining ourselves as a victim, we can call ourselves a survivor. doesn't make, in terms of the response to the experience itself, it doesn't change any reality. It is not less true. It is just a more positive and effective way to think of yourself. So that would be an example of reframing. And then using a sense of humor and having a sense of humor and encouraging the client to have a sense of humor about the problems that they are experiencing, realizing that we might be taking things too seriously. Some of the behavioral techniques, as I said, homework is frequently going to be used. It's a particularly important part of REBT, and the reason is that, remember I said REBT is a process of hard work and focus and attention over time, and homework allows the client to work on these irrational beliefs, not just in the weekly or monthly session with the client, but on their own time. So might be listening to CDs or reading a book or working on self-help forums or worksheets, things like that. But we would frequently use homework assignments in rehabilitation counseling. Homework assignments might well be related to job-seeking skills or participating in informational interviews and assigning contacts with employers and things like that. Skill training, developing social skills, assertiveness training, relaxation techniques, so teaching people skills that they that would help them to address the problems more effectively. For example, systematic desensitization, using imagery to overcome fear, anxiety, shyness, and that sort of approach to fears and phobias, for example. Emotional techniques or emotive techniques would include things like imagery, mentally practicing thinking, feeling, and acting the way that they would like in real life. So actually visualizing the talk that you're giving in front of the class and visualizing it going effectively, acting the way that you would like to act, feeling and thinking the way you would like to act in real life. And another technique is imagining the worst thing that could happen. Turns out that a lot of times the worst thing that could happen really isn't that bad. And so imagining the experience of inappropriate emotions, imagining the experience of the worst thing that could happen, and understanding that even the worst thing that could happen really isn't going to be that bad. Another way of thinking about it is then if you imagine the worst thing that can happen and then visualize changing the emotional response to the worst thing that could happen, changing the emotions to more productive or appropriate ones. Role-playing would be used to deal with some of those fears and anxieties that a person has. So practicing, for example, talking to an employer, role-playing that in the counseling relationship with the counselor. Shame-attacking exercises demonstrate the irrational nature of the fear of embarrassment. So we're afraid that it's going to be embarrassing, and so we're not taking action. We're not taking risks. So shame-attacking exercises give clients the assignment to directly confront their specific fears. For example, if you would like to, for example, meet more people and enlargen your social circle, then you might be assigned the assignment of approaching strangers and initiating conversations. So doing that thing which you are embarrassed of or ashamed of, asking a silly question at a lecture, singing out loud. And Ellis did all sorts of these things in his own life, encouraged clients to do it. Can be very can be very helpful. Obviously, it's a very difficult assignment, but in completing these assignments, the client learns that they can do it. They can train themselves to not be controlled by the responses or potential responses of other people. So, summarizing and looking at the REBT application and rehab counseling. Elements of REBT make it, on the one hand, very well suited. And again, this is a theory that has had a lot of application. A lot of people, including Allison himself, have written about the effective application of REBT and rehab counseling. There are also some potential limitations we'll talk about. But some of the strengths include the relationship, the counselor's full and unconditional acceptance of the client, valuing the client, listening to the client's worldview without judging, and then allowing the client to collect evidence to prove these views, reinforcing reality without judging, helping the client to give up absolutist expectations. All these aspects of the counseling relationship, counseling process, be very effective in helping the client to learn new skills and behaviors. Because it is a focused, active, directive, and intrinsically brief form of therapy, REBT does fit well within the more short-term rehab counseling model like used in the state VR system. So we've talked about like psychoanalysis tends to be a longer term therapy. Person-centered, tends to be not goal-oriented. REBT is basically goal-oriented. It is frequently focused on some very specific issue, and it is by nature a short-term therapy. So REBT does tend to fit the rehab counseling process. Some of the ideas in terms of working people in adaptation to disability or adjustment to disability. In the REBT framework, people with disabilities are viewed no differently from people who experience any other life misfortune. So disability is, like other misfortunes, an event to which people respond. A potential block to our goals, just like other sorts of experiences that we might have. When the focus of the counseling is the disability itself, the disability is seen as the activating event, and the counseling focuses on self-acceptance, identifying those beliefs and attitudes about the event, and looking at the consequences, and changing irrational beliefs. A number of writers also think about REBT and rehab counseling. A number of writers have suggested that REBT is appropriate and helpful with clients from diverse cultural backgrounds, educational backgrounds, and clients of varying intelligence levels, and with a variety of disabilities, including mental illness. So that's on the one hand. On the other hand, people have said that REBT is perhaps inappropriate with people who are not in touch with reality. People who are experiencing psychosis, dementia, and maybe people who are have experienced a significant brain injury, highly manic, severe forms of autism, and cognitive or intellectual disabilities. On the other hand, there are people who say that REBT may be effective with people with mental illness. So basically, there are two schools of thought. It works well with people from a variety of backgrounds, and with a variety of disabilities. May not work well with everybody. Elias and Pofu and colleagues suggested, again, going back to the adjustment to disability process, a potential limitation, and that the hallmark REBT assumption that clients are basically irrational in their beliefs creates the potential for counselors working with clients adjusting to severe disability to overlook situational factors that could actually make the experience of disability a genuinely awful experience. In other words, sometimes the experience of living with a disability, sometimes that is really is a problem and to quote Mpofu and all, a genuinely awful experience. And a client may feel as though you were not appreciating the depth of the experience, and not appreciating the extent of the disability.